So we're going to be focusing on the gag reflex. In the table provided above, there's a series of reflexes, all of which are very important for swallowing and also feeding. But one in particular that's very, very important is the gag reflex, and this is important because it's going to be protecting the infant's airway. So in any situation where a liquid, a solid, or a foreign object were to get too close and the baby was not prepared for swallow, this would elicit a contraction of muscles at the back of the throat, which would ultimately be protecting the baby's airway from any foreign objects entering. So just like an adult would have a series of problems if anything entered the airway, so too are babies, and these can lead to aspiration. They can lead to pneumonia. All of these things that are very, very difficult to treat and can be easily avoided. And so this is why this reflex is critical, and generally is a reflex that will be starting at birth and going all the way up until 7 to 9 months. At this point, the reflex is going to be transitioning a little bit as it integrates, and this just means that the reflex is going to be changing its location and the nature of the reflex as the child starts to develop. So this process, as mentioned, generally happens from anywhere from 7 to 9 months, and at this point, the place where the reflex is normally triggered for infants, which is at the front of the tongue, starts to gradually move back to the back of the tongue. And then this is very similar then to the reflex that adults have, which obviously would be near the back of the mouth, and that would then elicit the same contraction, but from a different location. Now, this change in location is quite important because if the baby's reflex were to stay at the tip of the tongue, when the baby transitioned to a solid, it would be very, very difficult for the baby to have anything, because that point at the very tip of the tongue would be triggered very, very often by solid foods. And this is actually why at this time the baby is not going to be able to take solids, and needs to stay with the feeding of the breast milk or the formula in order to avoid this. But because this transition corresponds to the time when it's appropriate to start with solid foods, it is also a helpful indicator of if we've transitioned to solids too early. So generally, when we're beginning to wean the child off of just milk and starting to introduce solids into the diet, it can be a little bit difficult to determine, if the baby is, ready for that. And so this is one clear indication of whether or not the baby is ready. If the baby persists to having gags, and if the gag reflex is activated quite frequently, then we know that this transition is too early and that we should be waiting a little bit. There's also other factors that can contribute to a difficulty with the gag reflex, and some of those include if the baby has a developmental disorder or delay, or if there's a tongue tie. That can be very difficult for a baby then to transition towards the solids. Now, gagging is a very natural response that a baby may have, and so if there is a gag that happens during feeding, that shouldn't be a red flag immediately. But if it persists, and if it's constant, and if the baby takes a very long time to recover in terms of like emotionally and stopping to cry, then that's something that should be addressed with a professional. Generally speaking, the best person to go to is the primary care physician, so the pediatrician that's working closely with the infant to make sure that the developmental milestones are being met, and also that the transition towards solids is appropriate. And so that would be the first point of contact, and then the second would be somebody who specializes in feeding in general, so like an SLP. So these people are able to give a series of compensations that can be done, or also give guidelines on how to transition a baby towards solids and when it's not appropriate. And then finally, the way that when testing this reflex, the way that it is elicited is again touching the front of the tongue. But this is something that we don't want to necessarily do quite frequently, and it's something that we basically avoid when possible. But that is generally how we can tell if there's a difficulty with the gag reflex. So as mentioned, this is just one of many reflexes that are all critical for the feeding and swallowing of an infant. However, it is one of the more important ones because, again, it is protecting us, or the baby, it's protecting the baby against a series of issues that result from any foreign objects or liquids or food entering the airway.